These are the tests that have been a key part of our opening up. The rapid antigen tests, sometimes referred to as lateral flow tests, marketed by US company Innova. They're the cornerstone of Operation Moonshot, and we're using them in schools, in workplaces and mass testing centres to help break viral chains of transmission.
Lateral flow testing will be of great advantage to us all as we go forward. The NHS is now offering, as I say, these free tests, and I think people should use them.
But the US regulator, the Food and Drugs Administration, or FDA, has produced a scathing report about the tests, including how it performs, how it's manufactured and packaged. The US warnings are stark. The FDA has significant concerns that the performance of the test has not been adequately established, presenting a risk to health, telling the public to destroy the tests by placing them in the trash. The accuracy of the Innova tests has been fiercely debated in the UK too. The government says extensive clinical evaluation by PHE and Oxford University showed lateral flow tests are accurate and sensitive enough to be used in the community, including for asymptomatic people. But others are more critical about what studies have found.
All of these lateral flow tests fail to detect people who've got low levels of virus when they get a swab. In Liverpool, of those who had high levels of virus, as the authors of the report state, they actually missed a third of those cases, which is meaning that it could be a useful test to find cases if we're using it in mass screening. But if we're using it to make sure people don't have infection, so for example, for going to football matches, to nightclubs and so on like that, there's a risk that we'll be missing people who could be carrying the virus into those venues.
In America, the FDA has never authorised Innova's antigen tests for use, despite the company trying. The company says the US concerns are not relevant to the UK, and they have made over 1 billion tests for the markets here. The UK government says the Innova test has already gone through our rigorous Porton Down assessment process, and we have a robust quality assurance process in place.
It's important that the company shows us and proves to us, given that they've been found to be lacking in their processes in the US, we need to know that they're actually sound here as well. So I think the onus is on them and the Department of Health to prove to us that actually the quality processes they have can tell us that this isn't going to be a repeated problem in the UK. And for example, in the student testing in Scotland, the University of Dundee had a batch. They ended up with over 35 false positives in their student population because of a poor batch of tests.
As the Euros start tonight, those going to Wembley will be expected to be fully vaccinated or have a negative lateral flow test. Yet in December, the UK regulator, the MHRA, told the government that they should not be used to greenlight attendance at events. We do not currently support the use of the test for a test to enable function until we are satisfied there is evidence to support this. Studies have now been done to assess their use.
There were several events at the end of April, beginning of May, where they did use it as a green light thing for events. And we still have not seen the research from that. And rumours are swirling around, and they are only rumours, that one of the reasons for the delay is not because the research is not complete, but because we're awaiting ministerial sign-off.
Like so many areas of science in COVID, mass testing is hotly debated and often polarised. And as the UK awaits the results of studies looking at how well they work in different settings, this looks set to continue.
Deb Cohen. Well, let's discuss that with our guest. Professor Alison Pollock is Professor of Public Health at the University of Newcastle. She's also the Honorary President of the Socialist Health Association. And Professor Alan Wilson is the President of the Institute of Biomedical Sciences. Good evening to you both. First of all, Alan Wilson, with now what we know now from the FDA, should we just simply stop using these tests?
I don't think so. There's absolutely no doubt that the gold standard test is the PCR, but obviously that doesn't give you the immediate result that the lateral flow device does. I still think there's a role for a lateral flow device, And I think the difference between how we use it in this country as opposed to how it's used in the USA is that we use it frequently, regularly, and in that way we almost compensate a little bit for its lack of sensitivity. So as long as you've got correct protocols in place, I still think there's a role for lateral flow devices. It's always an argument about if we don't do it, we will potentially miss cases is doing this test better than doing no tests. And I think there's an argument to say that this test does offer something. It will pick up some asymptomatic cases, not them all, I accept, but enough that to make it still relevant, I think.
But if you say if the right protocols are in place, but if you're doing it in your kitchen table because you've got a batch of 10 for your employer and you want to go to a nightclub or you want to go to a football match, you might do it casually, but it might actually lead to the spread of COVID.
I think that's the difficulty here. I'm not sure that it's appropriate to be using it for a one-off test for admission to something. I think that's the difficulty because that's not really what the test is designed for. I think it's much better as a mass screening almost exercise to do mass testing on asymptomatic people doing it regularly, and then when you will pick up a reasonable number of people of positive tests in an asymptomatic population. I think I would concerns for using it as a one-off test for entry to an event.
But what you're saying is that you've got a reasonable assumption of getting it right. We heard about the Dundee, there were 35 false negatives. I mean, isn't that problematic? Because how can the public now have confidence, especially with this FDA report? How can they have confidence in them? And secondly, how can they have confidence if the government's relying on them on a tool to let us move around more freely?
I think the Dundee study, any test can have done kind of a bad batch. PCR tests can have a bad batch and you can get false positives. And I know that's happened across the country. So it's not unique to the lateral flow device. That's a one-off bad batch and it can happen to any test. I still think that there's a role for it as long as it's used appropriately. And I think the only other thing I would say is that there is now a fairly easy access to PCR. So where PCR can be used as an effective replacement for lateral flow device, given that we have good capacity for that and a good turnaround time at the moment, I think it's still worth exploring some aspects and some circumstances where we would use PCR instead of the lateral flow device.
I mean, the Department of Health saying that there's proper evaluation processes. How often are these done? Are we going to hear more from Public Health England about that?
I'm sure we will, and my understanding is yes, all PCR tests, all lateral flow devices are regularly tested in Colindale and Portendown, and an issue there is to make sure that they are still testing positive for the variants of concern for the Delta and other variants as they arise. So it's important as these new variants arise to make sure that the tests we're using to detect the virus are still relevant.
Alison Pollock, if I can turn to you on this. You heard Alan Wilson saying they're still a useful tool if they're used properly.
Well, the problem is we just don't know. We're a year into using lateral flow tests, and there's been a complete lack of transparency with the government refusing to publish the evaluations. And you have to remember, 8 contracts have been awarded at a cost of over £2 billion. We've got 2 small studies, Liverpool, where they identified 70 cases, and the University of Birmingham, where they identified 8. That's for £2 billion. And the Department of Education is refusing FOI requests to publish the pilot studies on schools. So we really don't know. But what we do know is that there's no evidence that testing and test and trace has actually reduced transmission yet. I mean, it's quite shocking. The government's had every opportunity to conduct proper studies and proper evaluations, and it hasn't done so. And a big part of the problem is that these tests were developed for people with symptoms for clinical use. And what's happened is that Matt Hancock has put himself forward as the manufacturer. So we've got the Secretary of State now saying, I'm the manufacturer, and I'm also the regulator, and I'm going to give myself the emergency use authorization for using these tests outside of the manufacturer's scope. We've got an extraordinary situation here.
I mean, it's fair to say, Alison, that you have really been a critic of the government right from the start of the way they've handled COVID. I mean, that is your political position. But do you actually think they do more? You're a but you're also a practitioner, absolutely. Do you, hand on heart, think they do more harm than good? Seriously?
So seriously, we absolutely don't know. We spent £2 billion at enormous costs. And what we know is that is a huge opportunity cost. It's money wasted. And we haven't yet seen the evaluations. And all tests do harms. As the FDA has pointed out, they create false positives and false negatives. So of course they're doing harm if £2 billion could be spent on health, on social care, on education. That is extraordinarily harmful to society. And the other thing is we have no results on self-testing. But what we do know is that the number of people testing is going down because people have lost trust and confidence in the tests. So we're doing enormous harm and damage to testing and the clinical diagnosis as well.
Let me just put that final point back to Alan Wilson from you, Alan, that actually what Alison Pollock is saying is that people have lost trust in them. Do you get a sense of that, Alan Wilson?
I'm not sure I do. I think actually there's an accessibility to the lateral flow device that I think a lot of people find attractive. I would accept, I think, that every test is a false positive and a false negative. Every test does. And I think there is a risk from the lateral flow device that people who test negative think they're bulletproof and don the Superman vest and think that they can go out and do anything they want because they test negative and don't have COVID. And I think that's a strong message we need to get across to people. A negative lateral flow device doesn't really mean anything. You need to keep testing, keep doing it regularly. That's the value and that's the benefit, I think, from using lateral flow tests.
Well, thank you both very much indeed for joining us tonight.